morning, everyone. This is Jeff Shannon, Doctor of Audiology, host of Listen Up Rockland. Thanks for joining another monthly show here. It's a beautiful and very warm day here in early November, and I'm really excited to talk to you all today about a topic that has received a lot of attention over the past few weeks, few months. Actually, it started way back several years ago. This was initially started when President Trump was in office, and that's the OTC, or over-the-counter hearing aids that are now available to consumers today. So this specific type of hearing aids basically make these devices more accessible. I'll get into that in just a little bit. And so these OTC hearing aids means that a consumer can now walk into a store that sells electronics, such as like a Best Buy, or into a pharmacy like CVS or Walgreens or a place like that, without a medical exam, without an audiologic evaluation, and purchase these devices. There are some big differences between OTC hearing aids and prescriptive hearing aids, and that's what I want to get into to make sure that you understand what these differences are before considering to purchase them. We have had some talk on social media about this, so if you do want to call into the show, I welcome those calls. I'd be very interested to see if anybody has actually purchased a set of these devices and what their experience has been. But anyways, the number here at the studio, of course, is 845-429-1700. Again, Dr. Shannon with Listen Up Rockland talking about OTC hearing aids. The first thing to know is that these devices are these over-the-counter devices are only appropriate for consumers that have a self-perceived mild to moderate hearing loss. So it doesn't mean that they have a mild to moderate hearing loss, it's what they perceive as having. So that kind of does open up a question of like, how do you know if you have that problem? Well, you would kind of expect that you would have some difficulty in your everyday life, especially in noise or on complex situations, but overall you hear fairly well. That's sort of one way you could do it. But really the only way to know is by having an audiologic test completed, right? So you could go to your audiologist, have that test, and then you would know what your hearing is. So that's the first thing. The thing that these are not appropriate for is for someone that has a different type of hearing loss, or a hearing loss in just one ear, or some other type of medical condition that may involve tinnitus or dizziness. Complex situation where maybe it's due to something else besides the typical sensory neural type of hearing loss that we most commonly see, right? These are only designed for individuals 18 and over, so these are not appropriate for younger individuals, for children. They're not prescription, right? So what that means is, to understand this, is that you would purchase these devices and then you would sort of fit them, right? Yourself. There's no involvement of a professional, of a hearing care professional at all, right? So you have to think about, this could be appropriate for somebody who's a little more comfortable with technology, with their phone. You're going to be using your phone to do a lot of this. So you have to be relatively tech savvy to be able to self-fit and self-program. And we're going to get into that in a little bit as far as what some of the research that has been shown about the success of people doing this themselves. Another big difference is the cost, of course, right? Because first of all, just by removing a healthcare professional, whether it's an audiologist or a hearing instrument specialist, you're removing that cost there of that support, right? So, OTC hearing aids are ranging anywhere from a couple of $100s to a couple of thousands of dollars, right? Typically, hearing aids that include professional services are typically in the thousands, anywhere from maybe like $1,000 to $2,000 upwards of around $7,000. So there's a glaring difference there. So this accessibility and affordability are the two hot topics that we hear a lot about. Like, they're more accessible and they're more affordable, but what is the success rate of these? That's going to be the true test. If nothing else, right, we're getting more attention drawn towards hearing loss, right? Not a lot of people talk about hearing loss and their hearing, right? Many people have no idea that hearing loss is tied to cognition, right? That it's tied to brain atrophy and reduced cognition, right? It's related to your mental and psycho and social health, right? Isolation, depression. And and cognitive decline, right? And the worst case is dementia, where the greater the degree of untreated hearing loss, the greater risk of developing dementia. And that this can be modified, this can be corrected earlier in life before it becomes that problem, right? So it's drawing attention towards that. It's drawing attention also, I feel like, towards being aware of, what is my hearing like? Am I exposing myself to loud sounds? Just on the way over here, Dr. Hergen and I were seeing some landscapers without any type of hearing protection. If they're doing that every day for, let's say, 8 hours a day, 6 hours a day, they're putting themselves in jeopardy of having permanent long-term hearing loss. So just bringing attention to that too. So now what I want to get to is some very common questions that people have asked that I think are appropriate to hear and answer. And again, if you have some questions or some comments about the OTC bill or your experience with them or some questions you may have for me specifically as an audiologist, the number is 845-429-1700. First question that people say, well, wait a second, if I get this OTC hearing aid, the set of these devices, and it doesn't meet my needs, it doesn't meet my expectations, can I return them? Well, here comes the first big kind of question problem we have. There is no standard policy like there is with traditional prescriptive hearing aids. Traditional hearing aids that we have, right, have to have a standard return policy. For instance, in New York State, no matter where you go to get a hearing aid, a prescriptive hearing aid, you have a 45-day trial period, meaning at the end of that time, you can return those devices, right? With the OTC hearing aids, there's nothing in place right now. So that means that you got to be careful to think about that. Now, if you go to a place like Best Buy, you would assume that they have a return policy for those devices. Maybe it's 30 days, but please pay attention to that if you decide to do that. Secondly, are they programmable? Well, basically the answer to that is yes and no. They are not programmed to your prescription, but they can be adjusted by the user, right? So there's going to be settings that you can change most likely in your phone. So you have to have a smartphone to make these adjustments. You're not going to just be able to do it with a push of a button, right? So maybe something like with the pitch, like bass versus treble. But if the device is labeled self-fitting, then you can expect there has to be some type of app or accessory that's going to allow you to customize it to your listening environments and something like that, right? But nothing to the likes of like what traditional hearing aids, what we do, right? Because in our office, what we're doing is we're testing your hearing, we're fitting the devices, choosing a style, a brand, a type of device that's appropriate for the prescription and the type of hearing loss that the patient has, and then doing the follow-up work of validation, verification, follow-up, ongoing care, right? Insertion, removal, and all the things that kind of go into having someone be successful. So that's something where it's not, it doesn't have any of that support service. Will there be a time when we start to see some patients come in with OTC hearing aids and saying, I need help? The answer to that is a resounding yes, and we know that because research has already supported majority of patients or people that try some type of device that is currently available online want additional professional support, right? They want the backing of having a professional help them either during that initial process or when they have issues and they need to have things figured out. And I will tell you right now, that individual is not going to be your pharmacist or the Geek Squad at Best Buy. You're going to have to go to a professional like an audiologist to have that support, right? And we're happy to do that. That's what we do. That's part of our scope of work. It's actually sort of a new arm. We see patients all the time that have broken hearing aids or hearing aids from somewhere else or the VA that we kind of resurrect and get up and running again. But this could be a new sort of area of seeing patients that have OTC hearing aids that come in. Okay, if I want to try an OTC hearing aid, how do I know which one to select? Well, if you go online, let's just say you go to you go to Best Buy, and you're going to see they have about, let's say, 15 different types of OTC hearing aids. Well, like any consumer, you're going to probably go to the reviews. You're going to look at the devices and see which one looks visually appealing to you. But it's going to be difficult because you don't have a professional telling you which type is appropriate for your hearing loss, right? And just kind of a little caveat, if somebody has, let's say, a mild to moderate hearing loss, is that a high frequency mild to moderate hearing loss? Is it a flat mild to moderate hearing loss? Is it an upward rising? So just a lot of gray area there. That's going to be really interesting from our perspective of how kind of consumers navigate through. How do they know which one to get, right? How are they going to be most successful? Maybe they'll choose one that has more brand recognition, like a Bose, versus something that's sort of a new brand up and coming. So you want to look at the device, and again, just make sure that it can be returned, like tried and returned, right, in case it doesn't work out. And really, the question is, do you want to go through that process of doing that, right? We already talked about where you would get one, and we already talked about what they would cost. Like I said before, they're upwards of anywhere from like $200 to $300 to some of them are in the thousands, which is interesting because, to be completely honest, if you're in that price point, you actually could go to an audiology office, right? And we could stay competitive where the service is included, and you're getting that additional service that would basically, that additional professional service of verification and validation would outperform the OTC device without any type of basically having to do self-fitting. We kind of already answered this question. If I get an OTC hearing aid and can't figure out how to use it, where can I get help? It's put in place that with traditional hearing aids, you are guaranteed to have help number one, where you got them from, right? They have to provide that support. The manufacturer can provide support, right? With OTC hearing aids, there is no requirement there to offer you any help, right? So you're just buying this off the shelf, and that is it. So that's something worth considering and knowing as well. Okay. Touched on this a little bit. Is there any reason why I should not try OTC hearing aids? And the answer to that is yes, there are some reasons. So first of all, there's some medical reasons that I kind of briefly discussed. But number one, if you have any type of, like malformed, or the ear of your ear canal or your pinna is misshaped, that's number one. Number two, if you have any type of history of drainage in the ear, especially within the past, 30 or 60 or even 90 days, that would be number two. If you have any kind of history of sudden or rapidly progressing hearing loss, right? You do not. That's not recommended for you. You're not a candidate for OTCs. If you have dizziness, especially if it's long term or even short term, right? That could be an indication that there's something else in the inner ear or along that auditory system and pathway that could be causing this hearing loss as well. If you have a lot of buildup of earwax, right? You need to make sure that you don't have just earwax in your ears, right? So you should get your ears checked by your physician or by an audiologist to make sure that they are wax or foreign body is removed and your ear canal is clear, and that your eardrum is healthy as well. And if you have any type of pain or discomfort in your ear, right? Those are all reasons that you should be seeking medical advice or medical service first before considering purchasing an OTC product. And this kind of gets to the last question. This is kind of a known question, but if I'm thinking about getting help with my hearing, should I see a professional first? I mean, in my professional opinion, absolutely. Like, why not go see an audiologist and understand what your hearing is first instead of just going out and just purchasing these devices? I mean, you have the choice after this testing if you want to go buy an OTC hearing aid, but at least know what your hearing is before doing so. With not doing that could jeopardize yourself as you're trying to sort of self-fit these without even knowing what your hearing is. And that kind of gets me to a couple of things that I wanted to share. What is going to be the success rate of somebody who purchases OTC products and OTC hearing aids? How successful will they be? It just so happens there was a recent study conducted in which they actually used premium prescription hearing aids, right? And what they found is that basically the best, highest user satisfaction was with the premium level compared to the mid-level or to the low level. So first of all, the performance of the hearing aid mattered. But the other part about it was, I want to get to here, was talking about how successful they were with sort of self-fitting their hearing. Basically, this is a study done in 2017. And this provides some interesting clues. So it tested the outcome when adults aged 55 to 79 years of age with mild to moderate hearing loss chose among 3 pre-programmed hearing aids on their own for their ears. So again, these were high-end digital mini behind-the-ear hearing aids, so a very common style that we use in our office for patients, and it's appropriate for that type of hearing loss, right? A large majority of them, first of all, 90% of them, in fact, tried more than one hearing aid. They wanted to try, they were not satisfied with their initial choice, and then they had to go and try another one. So like that kind of is like questioning, like, are people going to be needing to purchase multiple OTCs to figure out which one is best for them? And do they want to go through that process, right? Close to 3/4 picked the wrong aid, prescription, of the hearing aid based on their audiogram. Their ability to know which one was best for them wasn't really, they did a very bad job of doing that. Now, why is that, you might ask? Wouldn't you, you would say, well, I like the sound of this one better. Well, we all know, and anyone who has hearing aids knows, right, that period, that first 30, 60, sometimes even 90 days, your brain is adjusting to sounds it hasn't heard for months, years, sometimes decades. You need that outside professional to say, here's where you need to go, and here's why, and here it is on the screen so you can see it. This is where we need to take you so you get optimal hearing, right? So that's an interesting concept where basically you could see a subset of people in this OTC, environment we're in, where they're actually fitting themselves with the inappropriate programming or type of hearing aid. So they think they're kind of doing, they have the good fit. And then what it kind of boils down to in time, they say, I feel like I'm not hearing as well as I should. Like in the beginning it was okay, but now it's not good. And now I feel like I can't get it adjusted right? So that could happen, just as a forewarning. That may not happen to everybody. It's going to happen to some people, but just a kind of a forewarning to that. But also what's interesting is that even though in this study, getting back to this study, these patients were given videos and received handouts of sort of like training, because you have to think about it. You have to learn how to insert it, how to program it, what happens if it's not working, wax guards, things like that. About 20% still asked if they could get extra help. They needed someone to go to. So that was interesting too. These volunteers for the study, in the end, they decided, do you want to pay for these hearing aids? And basically, they said you can get your money back, if you choose to return them. What ended up happening is about 50% decided to keep them and 50% decided to return them. So it was sort of a 50-50 toss-up. So granted, it was a smaller study. It was an excellent study done out of the University of Pittsburgh. There's going to be more studies like this coming out. So that'll be interesting as well. So another thing that I think that's interesting, hearing aids are free outside the United States. So in many countries, Australia, Iceland, Germany, right? Public funding makes hearing aids free for almost everyone. Yet the number of eligible people with significant hearing loss don't wear hearing aids. They still don't wear them. That begs the question, why? Why don't they get them if they're free? And in this case with OTCs, you're paying, right? They're not free. You're going to have to pay a couple $100 to a couple thousands of dollars, but a lot of people will not get them. When they ask why they don't wear them, or why do they return them, or why they choose not to, tend to say that they're not comfortable and they didn't give them natural hearing, right? So again, that gets into the delicate process of comfort in the ears, right? They have to be comfortable in the ears, and that sound quality and that transition, that acclimatization of going from initially hearing new sounds and working through that to the point where they are adjusted to your real world, but also optimized for your prescription, is a very delicate process. There's a lot of reasons to take action, right? So I've talked about the risks associated with untreated hearing loss and the risks of waiting to treat your hearing loss. We know currently in this country, consumers wait 7 to 10 years from the moment they notice they have a hearing problem until they actually take action, right? And maybe go see their doctor or an audiologist or an ear, nose, and throat physician. Maybe OTC hearing aids will encourage people to take action sooner. Maybe they will skip that medical, avenue and that pathway and say, let me just go into Best Buy and spend, $200, $300, $400, $500, $800 and see what this does for me. And maybe they'll get some benefit from it. And then maybe that'll take them to a point where they say, I still feel like I'm not hearing as well as I should. Now maybe I should seek out somebody else. And then the question is, well, who are you going to seek out? And my one thing that I will say is that you want to make sure the place you seek out follows best practice, right? And we've talked all the time about what is best practice. A few things you want to think about that this office or clinic does is that they have all styles, types, makes, models of hearing aids, right? This may include even cochlear implants or bone-anchored hearing aids or cross devices, number one. Number two, that they perform verification and validation testing. Verification is one of the main tests there is called real ear measures, right? They have to perform that, or they really should, right? And validation is how we're testing them in the office in various environments, such as like speech and noise. Follow-ups, systematic follow-up care to see the patient back on a regular basis, and not sort of like, unfortunately, like encouraging them to buy something new or different, or saying that these devices don't work and they in fact do, right? So there's that. But the best practice really is those first few. So that's something to be mindful of as well. Let me see how we're doing on time. I got about 5 minutes left. So what about very cheap hearing aids that you're finding online? I mean, look, you can see, if you search hearing aids right now on Google, you're going to see all kinds of ads come up and searching through some really inexpensive stuff. Devices that are not over-the-counter hearing aids, right? They can be called hearing amplifiers. Some of them are called PSAPs, which stands for Personal Sound Amplification Product, I believe. And they're really they're not intended for people with hearing loss. They're intended for people that have normal hearing, that want a little benefit in hearing, let's say, in quiet environments, let's say hunting, right? And they want to kind of hear out further, hear the environment in that sort of situation. But as far as that goes, I would highly encourage you to, number one, the first thing is just go get your hearing tested by a professional. And that way you know what you have, and then you can kind of go from there. So that's really important. I'm holding a webinar in a couple of weeks on November 17th. So this is a webinar with me. It's on Zoom. Usually, we already have a couple of dozen people signed up. You don't have to show your face or anything. You can just join and listen to a presentation and then some questions that people always have. It's on November 17th. It's at 12 p.m. It's on Zoom. There's a link on our website. If you go to hudsonaudiology.com, go to About Us, and then News, and I think it's like News and Events, and you'll see all of our webinars. We have monthly webinars. One of them is OTC hearing aids, right, and talking more about them. In that webinar, I'm going to go through some of the products that are currently available and show you some pictures of them and some of the pros and cons that we've already seen so far with them, right? So I encourage you to join that. But if you just have other questions, feel free to reach out to our office. You can send us a Facebook message. You can call our office. You can send us an email at info@hudsonaudiology.com. Happy to answer those questions because there's a lot of them out there. Just make sure that you're getting them from a reliable source. Okay? So that being said, I'm going to sound off here. If you decide to go the OTC route with hearing aids, just hopefully that you understand some of the things that you want to be armed with of knowing up front before you go down that pathway of purchasing and spending the time to do that. They're a good option for people who aren't ready for the care and services that an audiology practice provides, right? It helps with accessibility. It helps with affordability. It helps with overall awareness to hearing loss, right? As audiologists in our office, we see this as a new line of responsible work for our patients, for our consumers, for our, for Rockland County and Orange County, right? And anyone else for that matter. And to help answer the questions that people will have. And they need a trusted professional to become more informed before making that decision. Okay? And that work will begin with our team of audiologists, with our staff, of guiding those people through that process. So That being said, we've concluded coming to the end of the show. Hopefully, you've gotten some good information about this. Again, if you have further questions, reach out to us on hudsonaudiology.com. We will be back next month. Dr. Sophia Petrikis will be talking about how do you know if you're a candidate for a cochlear implant, and talking about what they are, and as the candidacy has now changed, especially for Medicare. So that'll be an exciting show on the first Monday in December. So until then, thank you for joining the show of Listen Up Rockland, Dr. Jeff Shannon, and have a great November. Take care.